Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Amir Bitar, who's a general cardiologist at the Heart and Vascular Institute at Monument Health in Rapid City. Dr. Bitar, thank you very much for coming in and talking with me. I appreciate it.
Thank you for having me.
You bet. Now, where are you from? You're relatively new at Monument Health, aren't you?
Yes, started 2 months ago.
Oh, so that is new.
Yes, very, very new.
So what brought you out here to South Dakota, Doctor? Where are you from originally?
I was born in Syria. I came in here about 10 years ago, finished my schooling, and I did my cardiology and internal medicine cardiology training in Florida. And I was like, let's change things completely. So
that is a drastic change for sure. Were you? So you've been here for 2 months. So you haven't been through a winter yet.
No, I have not.
So
my patients.
Are you looking forward to it or not?
Yes, the sun here is pretty great. They told me this city gets a lot of sun, even more than Florida, actually. So I think it should be okay. I'm hopeful.
I want you to come do another podcast with me at about January, and then I want to see if I get the same reaction for sure. Today we're going to talk about, and I'll be the first to admit, Doctor, I thought that both of these were synonymous. I thought a cardiac arrest was the same as a heart attack. But I think in this podcast, we're going to learn that they are two very different things. Sudden cardiac arrest specifically, correct? But they're not the same, are they?
No, not really. Heart attack, I think most people, when they refer to that, they imagine somebody that has the chest pain, they're holding their chest, it's a life-threatening event, they have to go to the hospital. And this is kind of what we'll use as a working definition for that for now. Sudden cardiac arrest actually refers to the heart completely stopping, no heart function, cardiovascular collapse, which means there's no blood pressure, we can't get a blood pressure, and we can't feel any pulses on somebody. So some heart attacks can lead to sudden cardiac arrest. Not all of them do. And sudden cardiac arrest can be the result of heart attack, but it's not always the case.
So what are some of the risk factors then for this? Warning signs that you should be aware of? Because when you describe it that way, that's it's ominous compared to a heart attack. A heart attack, you can have mild, you can have severe, you can obviously have ones that can kill you. Mm-hmm. So what are you looking for then if you feel this coming on?
Well, heart attacks are obviously a little bit better prognosis in the sense that you do feel some symptoms. You feel chest pain. Some people feel fatigue, shortness of breath, not necessarily sometimes chest pain, sometimes pain that goes to both arms, to the jaw. Sudden cardiac arrest, depending on what caused it, it could be a heart attack, but it could be something else entirely, can or cannot give you warning signs at all. Unfortunately, with cardiac arrest, not all the time we know if the patient had symptoms at all, even before presenting. Not all of them are witnessed, so we can't really tell if we do get any kind of prodrome before the patient has a sudden cardiac arrest. Just because of what it is, it's very hard to study.
So, what are some other? Outside of a heart attack, what are some other things that could lead to a sudden cardiac arrest? Are there other things as common as heart attacks that could lead to it?
That's a very good question, and it largely also depends on age a little bit. So a heart attack, when we commonly refer to atherosclerosis, or that plaque buildup in the arteries that supply the heart muscle. And when these get occluded in a sudden state, these will be called a heart attack. When the heart muscle is not receiving enough oxygen, it can become electrically unstable and can fire off into a very fast rhythm that doesn't cause effective heart contraction, and this essentially causes cardiac arrest. Now, this atherosclerosis that we talked about is very common as we grow older. with age. So in people that have cardiac arrest on the older side, it can be mostly due to coronary artery disease or that plaque buildup in the coronaries. But in young athletes, if you hear about athletes that are dying or young individuals, then the cause of cardiac arrest can be different. And usually it's what we call a malignant arrhythmia, which is an abnormal heart electrical circuit or a heart rhythm that causes the heart to beat extremely fast. And in beating very fast, it doesn't get the chance to fill that much, and so no effective contraction is happening, and essentially the heart stops.
Can something like atrial fibrillation lead to something like that too?
Not commonly, no.
Okay.
Atrial fibrillation usually is not coming from the bottom chambers of the heart. It's coming from the top. And there is a connection between the top and bottom chambers that sometimes slow down these very fast impulses from the top. So not everything makes it down to the bottom.
Now, you mentioned things like with young athletes. Was this similar to, there was about a year ago, that football player that got hit in the chest?
Yes.
Can that cause a sudden cardiac arrest as well?
Yes. It's actually a very, very rare occasion. I think, was his name Damar?
Yes, I don't remember. You're very close, but I can't specifically remember who it was. But it's not you. I've heard about this in kids that that play baseball and get hit in the chest with a baseball. That same thing, but that's so rare. As I mean, you wouldn't really factor. That's what happens, but I don't think you would consider that a lifestyle or
No.
Maybe with football possibly, but
this is a very rare event. It's a kind of for anything that strikes the chest at a very particular part of the cardiac cycle, and it can cause this injury can cause an abnormal rhythm called ventricular tachycardia or ventricular fibrillation. And it can cause cardiac arrest, yes. So
I see.
Very rare.
Okay.
Very rare
well, obviously, people want to do the best they can to avoid heart attacks. So there are specific lifestyle changes or preventative measures that they can do if they're working towards minimizing the risk of heart attacks. Then obviously that will also minimize the risk of sudden cardiac arrest. So what are some lifestyle changes, let's start there, that people should absolutely make to protect themselves?
Absolutely. And I love what you said, is that try to control the risk factors that cause a heart attack, and that would put you on the right track to kind of preventing sudden cardiac death, at least from that cause. So the number one big thing, huge.
Can I guess?
Yes, go ahead.
Smoking.
Yes, sir. Absolutely. Absolutely. The number one thing. And the risk of sudden cardiac arrest after stopping smoking drops rapidly and almost goes back to baseline. So the number one thing you can do to prevent heart attacks and sudden cardiac arrest, it would be to stop smoking.
Wow.
So
and that's
very important.
I suppose then, of course, we always hear about what you eat, and the exercise too would play a part of that.
Yes, absolutely. So exercise is very beneficial in coronary artery disease. Paradoxically, after vigorous exercise or during vigorous exercise, you're actually at a little bit of a higher risk of sudden cardiac arrest. But if you exercise, moderate exercise, continuous, consistent exercise actually protects you from coronary artery disease and sudden cardiac arrest. So both of exercise is very, very, very recommended.
Now
for your heart health.
There can be genetic plays a part in this as well, I'm assuming.
Yes, a lot of cardiac conditions we're born with, and they can predispose us to sudden cardiac arrest. A lot of athlete deaths that happen usually have some kind of structural heart disease or abnormal genetic syndromes. Yes.
Okay. So let's say somebody goes into, I don't know, how would you recognize somebody going into sudden cardiac arrest if it happened?
So great question. Usually they would pass out. There'd be loss of consciousness. They would have no pulse. You can't feel anything in their neck or their wrists. They would be breathing agonizingly shallow breaths or gasping or not even breathing at all, and they would be not responsive.
Then what is a bystander? I mean, obviously the first thing you should do is dial 911, right?
Exactly. Number one to do. I love that you said that. The number one thing to do is to call 911 immediately. You need help. So
And
ask
then,
for it.
and then, what can you do as you're waiting? Is there anything you can do as just a a bystander?
Absolutely. Two things have been proven to lower mortality and lower morbidity in sudden cardiac arrest. One of them is essentially defibrillation, if it is fibrillation or ventricular tachycardia that caused the cardiac arrest. Then the second thing would be excellent quality CPR,
Okay.
chest compressions.
Okay, I'm seeing so much more of that nowadays too, and I wish, there are classes that they offer to do this anymore, and I'm sure Monument Health has the opportunity for you to take those. You could probably research it and find them online to do. I know you'll see in a lot of social media where they talk about certain songs to do the compressions to,
Yes.
which I find kind of interesting. Is that something you've noticed too with these?
Well, the songs I've not been taught in medical school, but I've heard it on
the social
on
media.
TV shows
Yeah,
and stuff
right.
like that, yeah.
Well, this is these things are so important to talk about, and I think to bring to people's attention, because I don't think we talk enough about what people can do when they see something like this happen. We all know the risk factors. We all know that smoking and diet and exercise are something you can do to mitigate this kind of stuff. Genetically, not much you can do really, except keep yourself really healthy. But it was great having this conversation with you, Dr. Bitar, and I hope that whenever you have something else specifically that we can push out there to just raise awareness for, that you come back in and do this again, okay?
Yeah, absolutely. Thank you so much for having me.
You bet. It was wonderful talking to you.